What we've spent the last couple of years really working on is a product that does early and accurate detection of breast cancer in mammograms. We're not the first to the market with this. This product called CAD, Computer Assisted Detection, was really invented in the 90s. Bought by an industry giant about 10 years ago, and has been around for 20 years. The challenge is that the product on the market from the two of the three biggest players out there don't really work that well. If you read the literature, if you talk to the doctors, they use the products that are out there because they get reimbursed for using them, but not because they love them, not because they're really helping them save lives or make a giant difference in the clinical outcomes of their patients. So for us, our challenge wasn't just to build a Me Too product. It was to build something that actually works. Works for the doctors, works for the patients, improves clinical outcomes, improves financial outcomes, and would be something that the market would really want. So we focused primarily on a single metric, which is called false positives per image. One of the biggest complaints that the doctors have today is that when they use the current products on the market and they're reviewing a mammogram, the competitor tool marks up the mammogram like a Christmas tree. And so when it's marked up like a Christmas tree, they've got to take all those false marks and look at them and discard them. And it takes a lot of time, and it drives a lot of unnecessary biopsies because sometimes those false marks look true, and then the doctor has to send that patient forward to further testing and possibly a needle biopsy. So our goal was to significantly reduce the number of false positives presented to a doctor. So that when we showed the marks on a mammogram, the marks that we showed them were value-added, valuable marks that were truly suspicious regions of interest for the doctor. You know, when we first started the company in March of 2014, for the first 9-10 months of the company, we operated out of living rooms. I mean, and Starbucks and every coffee shop in San Diego. I mean, I must have put 25,000 miles on my car that year driving around San Diego to meet people. When we hired our first employees and we knew we needed an office, then we actually put ourselves in a Regis office right across the street here from Evo Nexus. But I knew Regis wasn't a long-term solution. It's really just temporary housing. So I began exploring the different incubators in town, and there's lots of different incubators. But I settled on really pushing to get into Evo Nexus and tried really hard to get in here because of the reputation of the incubator. I had been in Evo Nexus downtown with a prior startup that I'd worked at, so I understood the value that Evo brought over the other incubators. I understood the value of the mentors, and which is really that's the core. I mean, you could talk about the free rent or the free internet, and that's nice, and you can get that from a lot of places, but you can't get the depth of experience and access that Evo brings to bear for the startups. And that's what I really wanted. I knew when I was kicking this company off into a med tech space and I knew very little about it, that I was going to need help and guidance, and it was that level of input and mentorship that really made the difference for us.